Hello, my name is Dr. Jason Semprini. I'm an assistant professor at the Department of Public Health at Des Moines University College of Health Sciences in Iowa in the United States of America. And I'm happy to share my research recently published in the Journal of Rural and Remote Health. I have been a big fan of the journal for quite some time, not just showing some of the disparities facing rural people across the planet, but the great work and the interventions that are helping people in rural communities thrive. The article that I'm going to be sharing today is called The Burden of HPV-Associated Cancer in Rural America Beyond 2020. Now, what I want to do with this research, it's really just a brief report, a research letter, if you will, with some very specific objectives. We want to look beyond 2020. The COVID-19 pandemic disrupted cancer control systems across the planet, but we want to look beyond 2020. We want to look at what's been happening since with the most recent data available. We want to look beyond incidence. Obviously, incidence is important, risk factors, but we also want to look at the burden of mortality of these specific types of cancer facing rural Americans. We want to look beyond non-metro and metropolitan comparisons. We all know in this field that any way that we categorize rural versus urban, there's going to be heterogeneity within those communities. And we want to look beyond some of these uh, more aggregated comparisons. And in the United States, we're going to, here for this specific study, look more at the small communities, these micropolitan, truly rural areas. Just a quick recap. We know that HPV, or the human papillomavirus, can cause certain cancers, cancers of the cervix, female and male genital cancers, certain cancers of the anus and rectum, and oropharyngeal cancers. And in the United States right now, the highest incidence for females is found in the cancers of the cervix, and the oropharyngeal cancers are the fastest growing and much more common in males. And if we look at just overall trends, we see that incidence of these cancers associated with HPV have been rising over time. And we see the rural-urban gap widening over time. But what I want to draw attention to here, for both males and females, this gap and much of the research has generally looked at comparing metropolitan with non-metro. So these very high density populations with non-metro. And that non-metro group includes small rural communities, but it also includes non-metro urban communities, which we know very well may have much different levels of access and cancer prevention resources available to them. So for this specific letter to rural and remote health, we're going to look beyond. We're looking beyond 2020. We're going to look at incidence and mortality from HPV-associated cancers. And we're going to be looking not just at metro and non-metro, we're going to disaggregate the non-metro and look specifically at these small rural communities and look at the rates from HPV-associated cancer. And the question is, again, very simple. How did the burden of HPV-associated cancer incidence and mortality change after 2020? And how did it change specifically for small rural communities in America? This graph here shows, it's figure 1 from the paper. We see that the dark line, that's the small rural communities. The incidence of HPV-associated cancers are rising faster since 2000. And while that rate is quite comparable to the urban rate, both the rural and urban rates are much higher than the metro rate in 2019. Now, when we look at 2020, across the board, we see a decline, about a 7 to 8% decline in rural, urban, and metro incidence rates. For the urban and metro group, we see kind of level set. It gets back to the rate, the pre-pandemic rate from 2019. But what do we see for rural America? We see a drastic increase, almost an 18% increase from 2020. and it's much higher, even statistically significantly higher than 2019. And now we see that it is a much higher incidence of HPV-associated cancer in rural, even compared to non-metro urban communities. And we expect, given other disparities, kind of upstream prevention, other risk factors, vaccination rates, we predict that this rural rate will continue to rise and rise much faster and disproportionately than the urban and metro rates. And this very much contributes and will continue to contribute to disparities in mortality. And this is mortality from HPV-associated cancer, where it's either the underlying cause or a contributing factor to the death. And while we see that the urban and rural rates are quite similar, we would expect, given the rise that we observed in 2021 in incidence, that mortality will start to diverge for rural American rates. So I want to thank the editors and the peer reviewers at the Journal of Rural and Remote Health. Again, please check out the full research report. If you have any questions, you can contact me at my email or find me on Twitter. And with that, I leave you and everyone keep up the great work. Thank you.